It's been 4 years since the state of Massachusetts legalized medical marijuana, but only a handful of dispensaries have opened. After doing their due diligence and listening to residents, Somerville is preparing to approve its first medical marijuana dispensaries. Reporter Jeanette Origel brings us the details.
After the 2012 legalization of medical marijuana in the state of Massachusetts, 6 dispensaries have opened their doors for business. But with the state's more than 20,000 registered medical marijuana patients, 6 is not enough. Across the state, some cities and towns have sought to use zoning as a means to keep dispensaries out. Under the law, those rule changes can't be made so strict as to generally exclude a dispensary. In Somerville, the community and city officials have been supportive of medical marijuana and hope to see a dispensary open in the city soon. A zoning review and study delayed moving ahead, but with public feedback this winter.
Somerville being positioned on the red line and the green line is really well positioned to help people who would otherwise not have access or don't have the means to go to the more distant dispensaries.
A new zoning overlay map is now in place, allowing the city to open the application process. More than 24 people attended an information session for potential dispensary owners in April. Ward 5 Alderman Neidergang supports dispensaries in Somerville.
The whole point of having a dispensary is having something that people can get to and reach. And Somerville is a dense and a very easy to reach place.
Accessibility is one of the biggest concerns for city officials and groups like Forefront Ventures, who guide dispensary applicants through the application process and to getting their business open. Sam Tracy works with Forefront's business development team and applauds Somerville's approach when it comes to locating the dispensaries.
So that's one really nice thing about Somerville is that they've taken a much better approach than most other cities in Massachusetts have in terms of where they want to put these. Here we're wanting to zone them like any other pharmacy, like a Rite Aid or a CVS, because we want to make sure that patients have access rather than relegating it to industrial areas or treating it like it's some kind of vice rather than a medicine.
We want it to be in an area that is easily accessible. We want it to seem completely legitimate. We want it in the middle of a major square like Davis Square or Union Square because it's a medical facility just like this one right behind us, the Cambridge Health Alliance building.
The zoning overlay divides the city into 3 zones centered around Davis Square, Assembly Square, and Union Square. The zoning board will review all applications and make recommendations to the mayor. The mayor's office may give up to 2 letters of support in each of the 3 zones. Those who receive letters will then have to submit their documents to the state. For medical marijuana patients and advocates like Michael Crawford, getting dispensaries into the community can mean more than just easier access. Crawford suffered a spinal injury in the late 1990s and found medical marijuana was a positive alternative to painkillers.
I found it for myself not to be toxic, which means there's no overdose. You can't overdose on it. And you can't get addicted to it like you do with the pills. And the other issue, for someone like myself, 17 years, times 365 days, you're talking how many pills would I have taken and how bad would that be for my liver? This doesn't solve my issue, this doesn't cure it, but it allows me to work with the least amount of pain, and it allows me to get through my day, and it's good for pain management. That's really what it's about. It's about managing the pain I have on a daily basis, the nerve pain that shoots down my leg.
According to a new study published in the Journal of the American Medical Association, overdose deaths from prescribed opioids have quadrupled since 1991, and every day in the U.S., roughly 46 people die of an overdose. But in the 13 states that have passed laws between 1999 and 2010 allowing for the use of medical marijuana, these numbers have dropped dramatically.
What we've already seen from the data in states that have done it is that states with medical marijuana have about 25% fewer opioid deaths than states without medical marijuana. So the data has already shown us that allowing people to have that alternative actually does steer them away from that and saves a lot of lives.
The Cardiac Arrhythmia Syndromes Foundation, or CAS Foundation, is one of the groups that has applied to open a dispensary in Somerville. Their focus is offering a safer alternative to those who suffer from chronic pain.
The opiate epidemic has been tremendously devastating across the Commonwealth and the nation. And as we look at more ways to tackle these problems, medical marijuana continues to come to the forefront as one of the primary means of being able to tackle the opioid epidemic. By proactively putting these medical marijuana dispensaries in place, we can help relieve some pain that people are having without having the long-term devastating effects of addiction and the quality of life issues that arise as results of opioid use and subsequent abuse.
Somerville is looking for help from its dispensary partners in preventing opioid addiction. Drug prevention and public safety programs must be part of every application.
What's important to us is that we are a great partner to the city of Somerville, that we're a great asset to the community, and that we'll be able to give back and help with educational programs, support programs, addiction treatment programs, and certain other aspects that we can do to help the community.
We're looking to find the right applicant partner that we believe can run a quality operation, a safe operation, something that we will all be proud of having in the community and that will work well for us and with all of us.
The application period ended on May 20th. Applicants are currently waiting to hear back from the city, and if they receive letters of support or non-opposition, they will be cleared to advance further in the state's dispensary licensing process. For Somerville Neighborhood News, I'm Jeanette Origel.